think we are live, sir. Start. Rajiv, sir, I think we are live. You can start.
Hello, good evening, FMG friends. Welcome to the session. And this is post FMG evening today. And we, as a team of DocTutorials, are with you again. We were with you on 28th evening also, a night before the exam. And why not be together on the evening of the exam also? So like, I'm sorry. Just a second, guys. Sorry. A little. Yeah. So the exam is over now. And first of all, this is not a session to discuss questions. Let me tell you, this is a session to be with you again, because the journey does not stop it on the exam, evening. We have to really, take you through with this time, and that is till the time result is declared. And I know, after the exam, any exam, like our exam also, there's a vacuum in our mind. How did the exam go? And, first initial reaction is always like that. It was tough, and it was tough actually. We understand that, but as we have been saying that there are many questions which will be definitely have been knowing, and you are done correct. So let's really create the right kind of hope that will pass the exam. And in spite of all the fears for the first part of the paper, let me tell you, once the whole recall comes, you will see there are a lot of questions in paper 1 and paper 2 which will collectively make you pass the paper. Before I hand over the program to Dr. Khalil for the further subject and how the paper went, I want to say one thing to you guys. Guys, please relax a bit. You deserve this evening, and this is not an academic session or a motivational session or a programming session. This is the session, very casual connection with you guys. Please make sure you're relaxed. Actually, you deserve to relax, and you've done a lot of hard work. And please just make sure that for next 2 or 3 days, you call up your parents, talk to them properly, because you have been really cutting out all those things which were very essential for you. And you had, all sort of time limitation, but now you have time. Some of the things are pending from your side, from your health angle or parents angle and all. Please take care of them first of all now. And then, as the, days will pass, we'll definitely go to the exam result day also. We are together, believe me, not just here, then after NEET, PG, and a lot of other things are coming on our way. So without taking too much of time, I'll hand over the program to Dr. Khalil, sir, Radiology faculty. We will request him to really, guide us at how was this exam feeling, sir?
Yeah, thank you so much, sir. And good evening, all the students. And I hope you all had a good exam. I know there has been a mixed review. There is a moderate review of the overall paper. But a few important things that I would want you to understand from the analysis is it usually happens. I mean, I have seen people getting panicked after the day of exam, and but most of the time, they will see that the results come down in their favor. So in this analysis, first let me come down to what the students felt after the exam. Most students, right, they felt the paper 1 was difficult. They had slightly more in-depth questions in PSM especially, but overall it was a moderate paper. And now when the recall is happening, once the students are slowly analyzing it, it was a paper which was doable, not very easy, not very difficult, but I would suggest it would be a moderate paper with an average pass percentage. Was it predictable? The PYQs were lesser this time, and the questions were in the same topics, but the content asked, the questions asked, the options were slightly tricky. So it is important that we have an in-depth understanding of the routine topics rather than being too much into just one-liners or just chanting some one-liners and stuff. So they needed you to understand the topic well, which strategies work. Now, having good understanding of the classes, right, good understanding of your subjects, and starting early with in-depth analysis. So this is important for all the future aspirants also, that you don't just rely on just one liner. The exam testing you is in more clinical direction and more in-depth analysis. Content, knowledge, content is important. Knowledge, comprehension, analysis were tested, not just simple factual questions. right? Even in radiology, they gave a lot of questions asking you the radiology, not just asking you to identify the radiological image. They just went on to understand the treatment part of it. They gave you epidural hematoma, then asked you how do you approach the treatment for it. There were some easy questions also in radiology, especially when I talk about radiology. There was just a horseshoe kidney, a CT scan has been a repeat PYQ. It is there, and I hope most students answered it correctly. There was a question on double bubble, right? The duodenal atresia, and I hope many students that got that right also. And there was questions on radioiodine also this time. So topic of radiotherapy, radioiodine was also tested. And there was one question this was asked, and a lot of discussion is happening on this Popeye sign, right? And this is something, the rupture of long tendon of biceps also. And there were questions which were pretty much doable also in the paper. So once you analyze it down, don't panic with the, heat of the moment. Once you analyze it slowly and steadily, you will see that you will have marked all those questions. The tendency of the brain is to remember something that you have done wrong or something you're worried about. So you will forget the questions that you have marked right. So just relax. As Sir said, it's a time to connect to your family, connect to your friends. Do not worry too much about how the paper was and stuff. Take it as a calm session. You did your best from your side. You did everything that you had to do in the last 6 months. Now is the time to relax and have faith that good things will happen. And I'm sure by the time you see the recalls and by the time the results come out, you'll all be happy and successful also. Yes, sir. I think so. You're on mute.
Very rightly said, Khalil sir. Every paper is a mix of difficult question and easy question, moderate question. And paper 1 was challenging. Let's accept it. Last time paper 1 was easier and paper 2 was challenging. And NB is known to give us surprises. And I think our students are well equipped to handle surprises. Though the initial reaction always we always remember what we do not know, but we do not really sort of have that kind of feeling that what we know. But do not worry. When the result came last time, we were all we were thrilled that you see the result in spite of having the paper 1 or 2 so challenging last time. Guys, before I go further, let me tell you, for you guys also, for the future exams and for your juniors also, if you are in touch with them, this paper and the last paper, now there's a clear trajectory of FMG paper actually moving towards the pure conceptual paper. This paper 1 has shown very clearly that, we have to get more and more conceptual clarity. The era of one-liners, the PDF-based studies, the rapid reviews only, or, these kind of things is getting less and less now. And we must evolve and we must really rise to the occasion. And this is a time for you to guide your juniors also, that the shortcut approach should not be taken. The gap between the FMG and NEET PG is bridging very fast, man. Actually, this is very visible. If we as faculties assess the paper today, like a ENT paper, for example, paper actually is conceptual. They ask the same thing in the story format now. And we must really tell our juniors also that they should not take any, stopgap arrangement to prepare for the FMG paper of December. That's a very clear, message learning for the junior batch as well. I would request Rahul Rajiv sir, because medicine is always, like a challenging subject for the FMG paper. And again, there is no ECG this time. It's the second time we did not see any ECG as well as I got to know. So Rahul Rajiv sir, what is your impression about the paper, like medicine?
Yeah, so thank you so much, sir. And to all dear students, I'm sure that you must be relieved after several months of hard work. So it's not time to relax. And just a few suggestions from my side to the future aspirants. I'll just quickly run through 5-8 topics that were asked today, and I want to convey 2 messages after that. Now, just look at, say, 8 topics that were asked today. One is the ABCD2 scoring system in TIA. There was a question on JVP, question on Guillain-Barré syndrome, question on Duke criteria, pheochromocytoma, a question on amyloid associated with dialysis. And ECG, I think they did not give a figure, but there was a factual question on the ECG of WPW syndrome. Now, if you look, all these topics are important. The scoring system, JVP, WPW syndrome. The topics are important, but you will see that some of the questions are slightly twisted. Okay. Now, the problem is if you just learn in a shortcut manner, you will only answer if the question is direct as such. Okay, so if the question is slightly twisted, you might find it difficult. So having a look at the medicine questions based on the recall that I got so far from the students, I find that yes, most of the questions are asked from common topics, but some of the questions were twisted. So my message to the future aspirants, just two messages. See, common topics are commonly asked, uncommon topics are uncommonly asked. But for common topics, please learn them in the proper manner. The two advices that I want to give the December exam appearing candidates: number one, start early. Very important. Please don't wait. You start early. Number two, no shortcuts. The problem is, I have interacted with many FMG students. I've found them, they are putting so much of hard work, but sometimes what happens is they might go behind random study material. They might solve MCQs from some random Telegram group. They might actually learn from some random PDF, as the one sir was pointing out to. They're actually putting so much effort, but a proper channelized effort sometimes do not come in there. So my request is no shortcuts, because see, if you start early and go in a proper systematic manner, you will be able to cover the portions and also revise them. Okay. But the problem is, if you do not start early, what will happen? You will have to rely on shortcut materials towards the end. And I don't think that is advised. As the one sir said, the gap between a NEET PG pattern and FMG is only very thin now. You have got to prepare in a conceptual manner. And I think you are all capable students. Only thing is that you have got to channelize your energy and prepare in a systematic manner, which will give you ample time to study and ample time to practice MCQs and revise. So my dear students, no shortcuts, go in a conceptual manner and go in a focused manner. So this is what I want to tell the students.
Yes, thank you very much, sir. Guys, medicine is always, a fear for FMG student, or not for FMG, NEET PG student also. It's such a vast subject. But, as sir is saying that, the conceptual clarity was definitely tested in this exam more aggressively this time. And, people had the, this hope that paper one would be again a savior. But this time, I think reverse happened. We have our beloved anatomy faculty with us, Dr. Azam sir, from the first subject of the first year. Azam sir, please switch on your mic and please let us know how was the anatomy this time, sir.
Very good evening to everyone, all my dear FMG friends. First of all, thank God. After hard work of almost like 6 months, finally the exam is being done. And जैसे सर ने starting में आपको कहा था, like whatever has to be done, you have done your best. First thing is that thing. So don't be in that kind of dilemma right now, and don't be in that kind of situation of tension and again in life. थोड़ा सा relax हो जाओ. जो आपको करना था, आपने अपना best किया है. Whatever you have done is you have done your best over there, and it is done. खत्म. Now it's only the results that we have to wait for right now. सर मैं ये कहना चाहूंगा सर, राजीव सर, जो स्टूडेंट्स को like the message that we have like all the faculties to send from the DocTutorials platform is that now the era has changed. Now it is not about the one-liners. Now it is between the lines. Now it is not about the one-liners. It is actually between the lines. You have to now read between the lines, and that is important right now. तो ये वन लाइनर्स एंड ऑल दोस काम करने वाले नहीं है, and the students will be like preparing in a very strategic manner and just waiting for that last rapid revision sessions to be done, और वो कर लेंगे और हो जाएगा, वो काम नहीं होगा. You can see there. Okay, so that is a straightforward message that all the faculties will agree from the platform of DocTutorials. That is not the era of one-liners right now. No more. खत्म हो गया अभी. Now it is reading between the lines. तो between the lines आपको पढ़ना, in detail पढ़ना बहुत जरूरी है. Utmost important now. And when it comes to anatomy, sir, from anatomy, actually, like most of the questions were asked. Many questions came from anatomy. And of course, they were all like expected questions from the expected topic. As Dr. Rahul Rajiv sir said, They were not like uncommon topics, or all were from the common topics only. All regular topics, sir. Anatomical snuff box was given, a radial nerve, a wrist drop was given, and then the nerve supply near the lobule of the ear. Expected Tyrion. I was shouting in the classes that Tyrion, there will be definitely one question from there. And of course, always they are giving the question from EDH, epidural hemorrhage and extradural hemorrhage, whatever. So those questions came, and one question definitely from the tarsal bones. Always they are giving like navicular and all. This time they have given about talus. So it's all whatever I'm telling you. Meralgia parasitica, that question was given. Shoulder drop question was given. Extravasation of urine. They are repeating this question like many times. So why I'm pointing out all these topics to all my students here, when we have done the FMG booster session on DocTutorials, okay, and in that FMGA booster session, I'll just in a day or a couple of days, I'll actually post all the screenshot. All these topics are done. The only thing right now that we have to work out together, I'm telling we have to work out together, not pointing out at the students. Let us do the work together. At DocTutorials, we firmly believe in working together as a team, as a family. So I'm telling you, let us work out together from the next session onwards on the language of the questions. Questions were given from all the common topics. So many questions came from the anatomy, but the only thing is the language of the question. Language of the question, I'm telling you. Is it okay? I'll just tell you one thing. We have been learning about anatomical snuff box a lot of times. Lot of times we have studied in a funny manner. We have made the anatomical snuff box, the boundaries of that and all. What they have done just now in this exam, what they have done here, again there was a question regarding anatomical snuff box, but yes, they have added some masala to that one. A young man fell on an outstretched hand, and then there was some injury and pain developed near the anatomical snuff box. Which bone is involved? That means they're asking about the floor of that one. You have to answer scaphoid. Understanding? So it's same anatomical snuff box. You have learned the boundaries. You have learned the floor very well. You have learned the contents very well. Everything is done, but only the way they are asking the question, that is important. So इससे हमको ये समझ में आ रहा है कि हमारे कंटेंट में कोई गड़बड़ी नहीं है. As a student, you are learning good. As a student, you're learning the concept very good. The only thing is now, I think, sir, all of you will agree that now more emphasis has to be made on practicing the MCQs with a different language and all those things. That is important, sir. Otherwise, I think concepts, nothing to worry about that. तो जितने भी स्टूडेंट्स यहाँ पर ना बहुत मतलब naively, बहुत prematurely they are coming to a conclusion, as Dr. Khalil sir said, don't come to a conclusion right now. Just wait for 24 to 48 hours. Let all the recall questions come, then you decide. Don't be in a very hurry to decide कि अरे यार मेरे सारे क्वेश्चन गलत हो गए and all those. Human tendency होती है, हम नेगेटिविटी की तरफ ज्यादा अट्रैक्ट होते हैं. अरे यार ये भी खराब हो गया, वो भी खराब हो गया, ये भी गलत हो गया, वो भी गलत हो गया. आपने बहुत सारे क्वेश्चन अच्छे किए हैं, और मैं राजीव धवन सर की एक लाइन रिपीट करूंगा. इट डजंट रिक्वायर ऑल द क्वेश्चंस टू बी करेक्ट. Let's wait for 24-48 hours. Let us absorb this period. Let us see all the questions, then come to the conclusion. अभी के अभी ना पूरा डिसाइड मत कर लो एंड तक ना. मेरी लाइफ बर्बाद होगी, ऐसा कुछ नहीं है भाई. रुक जाओ 24 घंटे, थोड़ा सा अपने को चिल आउट करो, ठीक है ना? फाइन. तो all the concepts were good. The only thing is language. Let us work out in between the language, and please remember my line. It's not about one-liners right now. I'm telling you from the platform of DocTutorials. Not about one-liners. It is between the lines nowadays. All the best.
Thank you very much, sir. My dear friends, people who have appeared the exam today. So these all advices are for your future when you prepare for NEET PG. We all have one prayer in our heart right now. Whoever appeared in the paper should pass the paper. Whatever our faculty is saying is for the junior batches, because they will be also hearing that what actually exam was all about. So whatever we are saying is for the junior batch, and for you when you come to us for the NEET PG, because the paper is merging into NEET PG style. Actually, this is, let us say that we don't want to really be like shying away from saying it. Actually, paper is now merging into NEET PG. As NEET PG and INHCD margin reduced, now FMG NEET PG margin is reducing, and everything will culminate into next after few years, hopefully now. So that's what actually the game plan seems to be. My dear friends, pharmacology is everybody's fear, in particularly, like drugs, and every drug is a mechanism of action, and then, a lot of questions again this time. And pharma is an important subject. We'll hear from Dr. Nilesh Raj about what was pharmacology in this paper, sir.
Hi, everyone. I hope I'm audible enough.
sir.
Thank you so much, sir. Thank you so much for inviting me to this session. I'm very much happy, my dear buddies, because see, you are here. You have achieved something which has never one at like 1 in 1,000 has achieved, and that's the concept. You are here right now, which means you have finished the exams. Many of them are still having the fear, like whether we can attend the exams or not. Now you are here. Don't worry. You have done all the things which you have done best. As per pharmacology exams is concerned, I can see some of the questions which as majority has been previously asked questions. Majority has been covered up from PYQs. But the point is again, like what Azam sir was telling, we are facing lots of level 2 or level 3 questions. Level 2 or level 3 questions are simply like students will be, for example, if we have a straight liner, like drug which is used for iron overdose, the drug of choice is going to be desferrioxamine. But the question was not directly from that. No, that's what we used to call them as level 2 or level 3 questions. In level 2 questions, we will not be asking for level 1 questions, which are the following is the drug of choice for iron overdose. Level 2, they'll be giving a case scenario and they will be giving you that the patient has suffered from iron overdose. Level 3, they will be giving a case scenario. They will not tell them that this particular patient is suffering from iron overdose. That's the difference. That's the basic difference between level 1, 2, and 3, buddy. But the point is, even if, as I think I'm recurrently hearing those important terms, that is, we have to learn the concepts. See, stop looking at like this is going to be the next exam, because I'm very much sure that majority of the students who are going to be appearing for the next oncoming exams are there currently seeing this video. And I'm just giving you a small tip, guys. Please don't consider yourself as you're appearing for a separate exam. No, you're appearing for the same exams which has been conducted in a different manner. So that's it. The same NEET PG exams which is happening yearly, and you're going to be appearing for one more NEET PG exams. That's it. So did you look at the positive points from this? I think majority of the students will be having some negative points regarding what about this questions is getting difficult, and I'm feeling very much I don't know how I'm going to be putting up for the next exams. But no need to worry, guys, because you're going to be doing something which is going to be useful even for your NEET PG, and I'm damn sure that based on the questions which I get, based on the recalls which I get, and I'm damn sure as you can also be achievable enough to go through an INACT exams. So at present, what I'm going to be saying is, see, be the questions from HIV or be the questions from the regularly asked one like mountain sickness, like astazolamide, or even if the question is going to be from the general pharmacology, like your dose response curves, which we have seen, no need to worry, guys, right? All the questions have already been covered up in majority of the sessions, in all the sessions. The only point is you have to look at it from the patient's point of view. If you look at a graph, don't look at that graph and then convert it to a patient's point of view. Don't do that. You think of the question from the patient's point of view and come back to that graph. Because I always say that during the sessions, cardiac action potential is not drawn on a graph and designed in a human being. It was there in the human being and it was drawn back in the book. Always, whenever you come across any graph, any point, think of the patient's perspective and then come towards the graph. That is going to be useful for you guys. Over to you, sir. Adi sir, thank you so much.
Thank you very much, sir. Thank you very much. And we have Dr. Supriya now from Microbiology, and the second year subject pharmacology, microbiology. They have a major chunk in paper one, ma'am. What is, ma'am, your take on that? Like, how was microbiology in paper one?
Thank you so much, sir. So first and foremost, it was the same thing that was told by a lot of students. I don't really have all the questions of the recall, so that will take some time before, we would really get the pulse of what had happened. But like everybody said, I would want to second whatever was told. Concepts is what they are looking at. They're looking at concepts. They're looking at the understanding of subject. It's not just about how much you can mug up and remember. So understanding the concept, and there's the disparity, or there's this overlap that you see. Now you understand that all these subjects are related. So they are not different subjects. The subjects are sort of an overlap. So the questions are such that, there's an overlap with medicine, there's an overlap with ENT. So you cannot really say one subject is any less than the other. Understanding the concept has become very important. You have to understand and you have to apply. It's not just about knowing the concept, you also should be in a position to apply. So there's a lot of, treatment that you would want to give. There's a lot about the investigation which is advised. All of these, it's not just a straight microbiology question, it's about a lot of other concepts that they have merged together. This is what I've understood from what questions that were told to me. Having said that, it's not something that is not achievable, but like it is said, for the future, students, that this is what you have to know. You have to understand that, the only way you're going to clear the exam is, you have to start very early. Start early, have a focused learning. Every subject is important. You cannot say one is any less than the other. This is the take-home message. Over to you, sir.
Yes. Thank you very much, ma'am. Thank you very much. And my dear friends, as Dr. Azam said very clearly, and Dr. Khalil also pointed out that, as days will, pass, you will definitely start getting, better and better recall. So that's why we are not in a hurry to, do a recall tonight only, because actually we really want you to take a break. To be very honest with you, we do not want to bug you. This session is not planned to bug you, actually. This session is just planned to be with you. Because, sometimes there's a vacuum that what happened actually in the whole day. So sometimes you want to hear from somebody else who has really done this multiple number of times. So the main thing which you should really tell to yourself, even if I do not know how the paper went, I must have done a lot of questions correct. Let's wait for next 72 hours or maybe like 4 or 5 days. And then let's see the recall. And you started an idea, okay, I did that correct and that correct. And gradually started simulating, no, I am pretty hopeful for. So I'll say, let's give us benefit of doubt and be hopeful. That's one thing I can say. Because why to really, at least we deserve some amount of relaxation at this point of time. You also know that, it has been 5.5 months of very vigorous journey, and where you have done every possible thing and made every possible sacrifice now. And I know result would take some time, but before that, please, give time to yourself and to your family members. The most important thing, family members. That is very, very important. Now I will ask our dermatology faculty, Dr. Pallavi, to, ma'am, give your insight into this exam.
Hello, sir. Good evening to all my dear students there. I got to know that the exam was a little tricky, but also the good thing that I've come to know is that the dermatology questions were easy. So at least I added some good, positive part to this conversation here, in a sense that all the questions that were asked in dermatology were from the previous year questions, and there was nothing new that was asked which the students were not supposed to know. So everything, it's, I think, about the short subjects, as Dr. Khalil also mentioned, most of the questions were already discussed in the class and they were from the previous year's papers. Yes, certain questions were twisted a bit. They were added in a different way. Like 2 years back, you got a question on a patient with psoriasis and psoriatic arthritis. This time they just said that the patient has red scaly patches on the body and has an inflamed wrist joint. So again, they were only asking you psoriasis with psoriatic arthritis. It was not a new question. Exact same question had come 2 years back. Just that they changed the language of the question. And so is the same thing that Dr. Azam also mentioned. It is not that they have changed the questions. It is not that they are asking you anything new. It is all from what you have already studied. Yes, they may rephrase it. They may ask it in a different way, but it is nothing new. So take out that fear from your mind that, they will keep asking you new questions and you have to have a large group of books in front of you from which you have to study. No, you only have to study what you are supposed to study. Just study it well. Understand what you are studying, because right now they are not testing whether you have learned that one line or not. They are testing whether you have understood that one line that you have studied. So it's all about understanding and forming your concepts. So for all of you who have given the exam, I hope you did it well, because even though it was tricky, it was not difficult. So there is a difference between the questions being tricky and the questions being difficult. Tricky questions can be solved if you know your subject. So just try to understand what you're reading, and howsoever they twist the questions, howsoever tricky they make, you will be able to do it. Yes, we are not running after the difficult questions. So that is a very small part of the paper. So for all of you who have not been able to answer correctly the difficult questions, don't worry about it. I hope they are not the ones that will be deciding your marks. Your marks are decided by the easy and the little difficult questions. So hopefully you all will get the result that you want. And for the students who are preparing for the exam, you should hear from all of us here that you have only one option, is to study well, is to form your foundations well. When you are in the first year, second year, third year, final year, study your subjects well. Don't leave them till the last moment. That, okay, I will study these just before my screening test. No. What the NBME wants, what they want is that you become good doctors. You start preparing your concepts and your foundations from your day one of MBBS. So for all of you there who are still in MBBS, that is all that they want, that you just study well and form your concepts. And for the ones who have to give the next exam, like not the NEXT, it is the lowercase NEXT FMGE exam. For all of you there, just focus on what you are studying well. Focus on intensive studying, not extensive studying. That is the message here. Just study intensively, because the PYQ question is not repeated, PYQ topic is repeated. So go into your topic depths also. Study your important subjects well, but do not leave behind the short subjects, because it is the shorter subjects that give you, the good marks, because we don't have a lot of new things coming in into the shorter subjects. There it is mostly the previous year questions that are asked, and you should not go wrong in that. So study well, the shorter subjects being quite important for the PYQ. The bigger subjects, concepts, and concepts. That's it from my side. In dermatology, in all the recalls I've seen, there is nothing that I have not taught you. There is nothing that we have not discussed, and hopefully it stays the same in the future as well.
Thank you very much, ma'am. Thank you very much for that. And guys, we do understand that, the paper one, particularly the PSM part, was tough, and we share your emotion at this moment. And the remaining part, even the other subjects were also more challenging, as whatever recall I have got as of now. The paper one, agreeably, it was like higher level paper, not just the one-liner. Okay. Pediatric constitutes a one very significant part of the paper too. We have Dr. Sandeep Sharma sir, our beloved pediatric faculty, and I would request him to please tell us what questions, if we could gather by now, what type of questions came, sir?
Okay, thank you, sir. Students, I'm going to go in a different direction. I'll be brutally honest with you. I'm angry also for a lot of reasons, and I'm happy also for a lot of reasons. First, I'll tell you why I'm angry. I got two messages. I don't think you can see it here. So the message from one of the students says, sir, it was my third attempt. Very few one-liners in paper 2, definitely more difficult than previous. And I feel sorry for not revising the concepts properly. This is somebody actually messaging me just while the session had started. So I really feel bad, and I'm angry. Angry because many of you, we have been telling for so long that please do not stay focused only on one-liners. Yes, one-liners are important. They were there in the exam. Paper 1 had a lot of one-liners, but even those one-liners were not straightforward one-liner, drug of choice for this, investigation of choice for this. If you look at one-liners which were asked even in paper 2, like Sir's ENT paper, they were asking about laryngomalacia photograph, and they were asking what type of stridor it is seen. Now, what we remember is inspiratory stridor, but why inspiratory stridor? Where will you find? Do you find biphasic stridor? These are concepts, and these you cannot learn by, only a small last-minute revision or by 10 readings of a quick revision program or a, one person teaching you all 19 subjects. I'll be brutally honest today. I'm not pointing out anyone. I'm pointing at those people who have given the exams previously, they haven't done well and still keep making the same mistakes. Do the mistakes, but don't repeat the mistakes. Number one, that is the first point why I'm angry. Second point, why I'm happy, because this was a paper in which, see, it is a human tendency that we tend to think more about the things which we have marked wrong or which we have been thinking about. You tend to forget about the things which were easy, you immediately mark and you have forgotten about them. So let it sink in and you would realize there were a lot of questions which were actually easy. Pediatrics had questions in paper 2, obviously, but there were some questions in paper 1 as well. What I mean by this is not that pediatrics is giving a lot of questions. What I mean is papers are becoming more and more integrated. So there are a lot of pharma questions which were a part of psychiatry, related with psychiatry. Pharma was there in medicine, pharma was there in surgery. So you do understand that yes, one-liners will be needed, but at the end of your preparation, if those who will be appearing in December exam, it's a warning sign for you. Start reading properly, start understanding, and once the exams come, then focus. For those who have given the exam, nothing to worry. You have done whatever you wanted to do. End of the day, you need 150. And I'm quite sure most of you will get 150, right? So galti sabse hota hai, it is absolutely fine. Now the analysis, paper was moderate. This is what people have said. If you were well prepared, you would have found the paper easy. If you were not well prepared, you would have found the paper tougher. Paper 1 was definitely tougher compared to last 2 years. There is no doubt about it. One-liners were there, but they were involving the concepts. Anatomy, 5 questions were easy. A few questions were difficult. I think Azam sir will agree to it. PSM was on the tougher side. Nerve injuries, anencephaly, expected topics. Diarrhea, dementia, wound healing, zinc deficiency, acrodermatitis enteropathica. I told you in the class, if you mark this question wrong, I will find you. So those who have marked it wrong, I will find you. So be ready for it. Capgras syndrome, image-based questions. Some of the image-based questions were tougher. Coming to my pediatrics, yes, pediatrics questions were easier, but at the same time, neonatology had tough questions. So there was one question on shock management, tough, even for NEET PG students. One difficult question on day 1 fluid, how much to be started? Definitely difficult for NEET PG people. Absolutely okay. Remaining pediatrics, CMV, thousands of times asked. So celiac disease, what is safe? See, poha is made of rice. Rice is safe. We have discussed it so many times. So if you have not eaten poha, one student says, sir, I have not eaten poha. Now, you cannot sit in a shell and expect that you will get selected. They also check for your general orientation. So come out of your shell, come out of your libraries, go to the classes, start reading conceptually. And I'm quite hopeful most of you will be doing well. Don't look at what pass percentage it will come. Recall sessions will happen in due course of time. But now it is the time to be hopeful if you have given the exam. And for those who will be targeting the December exam, warning sign for you. Read conceptually, there is time. Last month, shift gears and go into a 2020 mode, one-liners. I'm not saying one-liners are not needed, but this is the time that you can build concepts. But my purpose of being angry and all this rant, it is all coming out naturally. Now, normally you all know that I'm very patient. I'm a pediatrician. Patience is what I need to see my patients. But at the same time, the message, somebody needs to put it through. It's not about individuals. It is not about institute. It is not about my own programs. I have taken rapid revision classes face to face. I finished the subject in 1 day. You get some question out of it, excellent. But if you really want to get 180, 200 or in that range or safe range, those who have prepared well and read and understood, they would always have the edge in exam. So please understand, learn from this, learn from your mistakes. Do not repeat the mistakes. Over to you, sir.
Okay, sir. Thank you very much, sir. And the angry word from your side are very legitimate. It's just like an elder brother telling a junior at home, this was what required, and the future people who are hearing us should really mend their ways right now. That's absolutely acceptable, I think. That's what the doctoral family is all about. The interest of FMG students is core in our genetic code, actually, I would say. And that's what the session is, again, to stand by your side tonight, because, we feel lost, actually. And we want to tell you, do not worry. Within 3-4 days, you get a lot of recalls. Let me read out like ENT questions just to give you I only got a topic names. I did not bug anyone. Tell me the statement, tell me the choices. That's for just next 2 or 3 days. But I think very expected things. I'll be over there again. When the Bulla epidermodalis location was asked, laryngomalacia, as sir said, they asked a very beautiful clinical question about the inspiratory stridor supraglottis. Then a question about the adenoid hypertrophy management. Then which artery bleeds in epistaxis most commonly. Then something about the croup and stridor, the breathing difficulty, child with scenario created with aspiration issues and all that. Then again, corneal atresia with the McGovern technique, but very nicely, the pediatrician could not pass the suction catheter through the nose. As we discussed in the class, was a very beautiful integration of pediatric ENT. Again, ophthalmology, ENT integration in the form of chronic decrecystitis with DCR surgery being discussed over there. Then they asked about the beautiful question of nystagmus, NEAT PG question. We discussed in class cows, cold opposite side nystagmus, that came. The Ramsay syndrome, genicular ganglion lesion of the facial nerve, and with the, history given, the facial nerve with some lesion on the pinna. And they asked the site of, where the virus got reactivated, genicular ganglion, anatomy, ENT, medicine mix over there again. Something about the nasal polyp, enteroconal polyp, etc., etc., etc. There are many more topics over there. I'm just reading why I'm reading the topic, not tell that actually the essence of this exam is that please start early for the future people. For all of you who are prepared today, we only have one wish, one hope, one prayer that you pass the paper. For the junior ones, we're telling, start early. Please be very conceptual. Whatever you're doing, keep your mind open. Imagine the situation, and we discussed in the class also. And the things are being asked in a story format. That's what they are doing. But paper, agreed. Paper 1 was challenging, but as Khalil sir right in the beginning said that, let 72 hours pass and you will get a lot of questions and you'll feel, no, I've done this correct. I'm safely going to cross 160, 170 over there. Anybody has to, add anything? Any faculty wants to add anything at this point? Khalil sir, anyone?
Post-exam, what are the, tourist destinations that you would recommend?
The best tourist destination is your home. You have not been to your home properly. You have been, locked in your house only, or maybe staying in guest house, PGs and hostel and all that. Please get to eat some good food. Meet your friends also, because, I understand, it's easier said than done. But tonight, you have friends, every night you used to feel guilty that why I've wasted time with my friends. Tonight, you don't feel guilty tomorrow. So waste your time with that's the most beautiful part. If you don't have family, friends or family right now, if you're staying in, Gautam Nagar, Hyderabad, Chennai hostels, be together, celebrate this moment that you have done your best. When we are saying this, that you should have been conceptual, it's for the future batches. I have 100% confidence after interacting with thousands of FMGs, you really have put your best foot forward. And that's a matter of respect from our side. And you should also respect yourself, so that tell yourself you deserve a break right now. Okay? A break with your friends, a break with your family, and maybe a solo trip somewhere. Why not? Result, jo bhi aana hai, ab to aana hai. Ab to lock ho gaya. Ab to kuch nahi kar sakte. We cannot do anything about it. Only thing is keep predicting and really waste time. Rather than that, why not invest time and cultivate a positive personality also? You know what? That's most important thing. At the end of the day, you get a license and you should ooze positivity when a patient looks at you that this guy can save me. And all these solo trips, parent interactions, your friends interaction, they're going to really create your personality like that. So do not really, keep predicting. Rather than that, I think let's, start at least having some moments of ease and comfort and pleasure with your family and friends. Anyone else has to contribute?
I think it's important to be hopeful, and this is a very crucial break you will get in your medical journey. It doesn't happen. I mean, once you even clear the exam, once you start your internship, it's a hectic thing, even your postgraduate preparation and all. So it's a very crucial phase. Don't be isolated. Don't be, always ruminating whatever is going to happen and all. So just, use this break productively. Don't be isolated. Visit your family, friends, and at the same time, stay hopeful throughout the course. And I'm sure most of you will come out successful. And, all the future aspirants listening to us, it's important, as everybody has said, that, you have your content learned properly. Do not go for shortcut methods. It is important that you start early and have a conceptual understanding, even for the people who are preparing for December. Do not look for shortcuts. Do not look for small materials. Do not look for कि सबसे कम किस में है मैं वो लेके पढ़ूंगा. Sir 3 दिन पढ़ा रहे हैं मैं 2 दिन में 1 दिन में पढ़ लूंगा आधे दिन में पढ़ूंगा. Please avoid, especially in the early part of your preparation. Whatever is going to happen is in your initial months. Last में क्या होगा वही होगा. हम लोग we'll start having that tendency to go for shortcuts. But at least in your initial journeys, July, August, September, this I keep telling that these months will decide. what your December result is going to come. So how good your effort is there. That learning that happens when you're watching the videos, that learning that happens when you're in the classroom, that is more essential for your results rather than relying on very shortcuts and stuff. Okay, and the topics were doable, as most of the faculties have discussed. These are doable topics. Just that our preparation should be on top, and I'm sure most of you after the recalls will see that you will be clearing the exam. Our prayers are with you, and I hope all of you come out successful and be part of our medical community soon. Yes, sir.
So with all your permission, may I close session with one thing only. We all faculty members, we all team members at DocTutorials pray for your success in the examination. And I just want to tell you one thing, that this is also culmination of us tonight, a series of programs we have been doing on YouTube with different, like 1 month before the exam, a week before the exam, a day before the exam. And I'm really glad that, you guys appreciated 28th night when all faculties came together on the screen to really, be with you. And believe me, that's what actually we love doing at DocTutorials. It's not like, it's a passion to be with you guys in all spheres and, ways and means possible. So that's what. And thank you very much for appreciating that. I could see that on social media also. And this is our pleasure. It's our pleasure to be with you guys. And today, this is also culmination for us for the series of things we have been doing on social media and the rapid revisions and the in-app also. And we are ending this session tonight with just one hope: whosoever appeared in the paper, may they pass the paper, and then meet us again for the further exam, NEET PG, and elevate the career further. Thank you very much, guys. We'll take leave from you.
The best, guys. Thank you so much.
Good night, everybody.
Good night.
Enjoy the night today. I hope you all party hard tonight.
Party hard, yes.
Bye, guys.
You will get selected. You will get selected. अभी कुछ recall नहीं देखना है, बंद कर दो. Do it tomorrow or day after.